Chapter 31, Orthopedics, Part 1. Their learning objectives and the terms you should know. The skeleton is broken into two parts. The axial, which consists of the skull that has 8 main bones that are connected by tough tissue called suture, and facial bones that form the orbit of the eye, nasal, sinus, and jaw. The vertebral column and sternum, which has 24 vertebrae, 7 cervical, 12 thoracic, and 5 lumbar, and the sacrum is 5 vertebrae that have been fused. And there are 12 pair of ribs. Ribs 1 through 8 connect to the sternum and is connected by costal cartilage, and ribs 11 and 12 are floating ribs. The appendicular skeleton consists of the upper extremities, the shoulder, scapula, clavicle, humerus, the long bone of your arm, the ulna and radius form the forearm, and the carpal and the metacarpal bones form the hand and wrist. The lower extremities include the pelvis, the thigh bone or femur, which is the longest bone of the body, and then you have the patella, the knee area, and the lower leg, the tibia and fibula, and your foot and toes. There are different types of bone tissue found in the body. Cortical is found on the surface of the bone and organized in tubular rings called osteons. It provides nutrition and carries away cellular waste products. The ends of the bones in the inner layer are composed of softer, dense cancellous bone. It resembles a sponge. The spaces are filled with red marrow that produces blood cells and found in the center of some long bones. Pelvic bones and the vertebra contain yellow marrow. Bones are covered in a bilayered membrane called periosteum. The purpose is to protect the bone surface and provide attachments for tendons. Long bones are characterized by having a middle shaft called diaphysis and the 2 ends called epiphysis. The legs and arms and fingers are examples of these types of bones. Bones are classified by their shape. The wrists and ankles are examples of short bones. Face, spine, and vertebra are examples of irregular bones, also referred to as sesamoid bone. The patella, for example, is an example of a sesamoid bone. Flat bones are usually thin compared to the others. In adults, the intercancellous layer of the flat bones contain red marrow. In other types, the red marrow turns yellow. Rib, cranial bones, scapula, and sternum are flat bones. The purpose of landmarks on bones is to serve as an attachment area for tendons and ligaments, and also create a pathway for nerves and blood vessels. They look like raised areas or bumps, ridges, channels, and tunnels. Joints are the articular system of the body. This is where 2 bones meet and some degree of movement occurs. It could be a small or large movement. The joints are determined by the type of movement they allow. Synovial joints are composed of articulating bone ends, and the connective tissue that surrounds them is covered by a capsule. The capsule is lined with a membrane that produces a viscous fluid that lubricates and nourishes the joint. It is also where the nerves and blood cells are contained. Non-synovial joints are separated by immovable cartilage or fibrous tissue. They have fixed articulation. Joint movement is the basis for body movement. The different types of joint movements are hinges, like in the elbow. It has a rocker and cradle component that allows for extension and flexion only. Saddle, where the joint has a convex concave shape that allows the bone to slide over each other. The only saddle joint in the body is the thumb. A gliding joint is when a flat surface of the bones slide over each other, for example the vertebra. It allows the spine to flex. Ball and socket is a joint with spherical and concave components allowing movement in several planes. It is the most freely moving joint, such as the hip and the humerus. Pivot joints have a bony protuberance and an open collar component. Pivot joints have a bony protuberance and an open collar component. The first and second vertebra of the neck is an example. It allows for rotation. An acondyloid joint is a joint with a small protrusion. It slides with an elliptical component like the carpal bones of the wrist. Tendons attach muscle to bone and ligaments attach bone to bone. There are three major muscle types. Striated, also called skeletal muscle, is composed of fibers and bound together by sheaths of fascia. Striated muscles are voluntary control and makes up most of the body tissue. Their primary function is to provide skeletal movement support for body posture and maintain body heat through anaerobic metabolism. Muscle groups are attached to bone by tendons at two fixed points called the origin and insertion of muscle. Smooth muscle are involuntary. They are found in the internal organs such as the stomach and bladder. The muscle has two layers. When the muscle contracts and relaxes, the contents are moved along, called peristalsis. It's common in tubular structures. Cardiac muscles are striated but involuntary. They are responsible for the sustained contractions of the heart and movement of blood in and out of the heart. It is driven by a complex series of impulses from the autonomic nervous system. Different diagnostic procedures are used to diagnose orthopedic trauma and disease. Radiography is the first level of assessment, usually an X-ray. MRIs are used for diagnostics of fractured spinal cord injuries and tumors of the musculoskeletal system. CT scans for complex fractures, joint disease, and trauma. The CT scan provides a cross-sectional image. CT angiography are angiograms used to diagnose vascular injuries caused by trauma, and ultrasound are done in all cases involving complex traumatic injuries. Patients are positioned for surgery on a standard operating table or on a specialty table such as a fracture table. This table is used for surgery on the femur or lower leg. The table supports the operative leg while providing access to the femur. It also allows for safe and rapid positioning of the C-arm fluoroscope. Many standard operating tables can be converted to allow for femoral or lower extremity by removing the foot section of the bed and replacing it with an adjustable leg suspension device. The Fowler precision is used for shoulder surgery and adjusting the articulated sections of the table and replacing the normal headpiece with an open design head stabilizer. Bone bleeds. It comes from the tissue that has been cupped and the capillaries that cannot be ligated. Total blood loss from orthosurgery can be done by weighing the surgical sponges and measuring the volume of blood in the suction canisters. Tourniquets are used in most extremity cases. Tourniquets have been associated with skin, nerve, and vessel damage when used inappropriately. Another way to provide hemostasis for bone is to use a bone putty or bone racks. Orthopedic surgery is done with particular attention to the risk of contamination from airborne or droplets. Infection after surgery can result in destruction of the joint with no way to treat it. Common dressings used in orthopedics are fluffs, ace bandages, Coban, and stockinets. The classification of fractures start with naming of the bone and the location of the fracture, the pattern of the fracture, the level of comminution, and how many fragments of the bone there are. Displacement, is it still in alignment? Fracture patterns are transverse, where the fracture line is perpendicular to the long bone. And an oblique fracture is a fracture that occurs at an angle. Spiral results in a twisting or a torsion of the bone. And impacted is when a bone is driven inside another bone. Comminuted is when the bone is in two or more pieces. Open means does a fracture penetrate through the skin, and a green stick is a fracture of immature bone. It's usually seen in children. And depressed refers to cranial fractures where the fragments are pushed inward. Reduction is a process of bringing bone fragments into anatomical alignment. This is usually done with the patient under anesthesia and may require the use of a traction device. After an injury, the swelling can make the reduction more difficult to accomplish. Open reduction is when an incision is made as part of a surgery. Closed reduction is a manipulation of the bone with an external traction device that pulls the bone fragments into position where no incision is made. Distraction is used to elongate a limb or structure during surgery. Open reduction internal fixation means that you're making an incision and using plates and screws to keep the alignment. Open reduction external fixation is where you make an incision to align the bones, but an external fixator is used to hold the alignment. External fixation is stabilizing the bone from outside the body using external cages and frames. Closed reduction external fixation is where the fracture is reduced manually and the external fixator is used. Bone healing occurs in phases. Inflammatory is when the bone suffers a traumatic injury. Reparative is where the growth cells proliferate and form a callus, and that's where it fills the space between the bone fragments, normally occurring a few days after injury. During this phase, a capillary vascular system develops within the matrix, and the remodeling phase, the replacement of the initial bone matrix with compact bone cells and absorption of excess callus. Any questions?